Hi everyone, this is Jed Shlackman. I'm a holistic counselor and also a spiritual energy healer. And for this short video clip, I'll be speaking about the mindset or the psychology of how conventional medical institutions often operate. And it's kind of a cult-like mentality or a cult-type mindset. And first we're going to look at what really that idea of a cult is. The word cult is a shortened form of the word culture. So a culture has social and psychological aspects to it. So you have groups of people who are functioning socially, interacting with one another, and then there's a psychology that is present in those interactions. So cultures have their particular ways of thinking and functioning and conforming, perhaps. So what people refer to as a cult tends to take the basic elements of a culture and carry them to an extreme to maintain extreme conformity, extreme control over the collective consciousness of that group and of their behaviors, of how they function within the group and outside of the group. And let's apply this idea now to how some of the conventional medical institutions and organizations tend to influence the consciousness of their members or followers and of the general public as a whole. So in the conventional medical system, you have physicians who are taught that they're giving certain types of treatment, and the treatment is meant to treat specific illnesses or to attempt to cure diseases. So this is some of the language that's used within that culture of modern medicine or conventional medicine. Now, if someone is a practitioner who's working outside of the convention or the mainstream, they will often get attacked or denigrated, and it's being said that they're doing unscientific practices, that the methods of treatment they're using haven't been proven to cure any illness. It's also often a matter of using certain language or terminology that's meant to demean people. So natural-oriented doctors are often called quacks to make it sound like there's some type of fraud involved in what they're doing. And if someone is a physician in the mainstream and they're looking into trying out some of the other types of treatment approaches, other paradigms of healing, they may be threatened. They may risk losing their license, not getting the insurance payments for their services that they would normally get if they're using the mainstream doctrine or standard of care. So there's financial leverage involved also in pushing people to conform and go along with the cult mindset of conventional medicine. And of course you have the pharmaceutical industry, the companies that make or manufacture the products which are widely used and prescribed in mainstream medicine. So they have a lot of influence on medical education. So in a sense it's indoctrination rather than education, since the particular doctrines that promote drug use are pushed to doctors, and alternative approaches are suppressed and ignored to a great extent. So doctors aren't learning about other modalities, other forms of treatment. They're not learning about how diet and nutrients and oriental medicine and energy medicine and other natural or less invasive approaches are effective at helping people. There's also the bias in terms of what gets allowed into medical journals or scientific journals. So if your particular treatment approach or modality is not very amenable to the typical mode of research design, then it may not be included in the types of research information that are presented in medical journals and made available to physicians. There's also a bias or prejudice that's taught to physicians in terms of what is acceptable medical research or journalism. So it's taught that some particular journals are the authorities, the respectable publications, and if you're looking at information that's being shared, research being presented in some other lesser known or less widely embraced publications, then you're looking at information that's not respectable. So it's taught or presented that some things are coming from authority and other types of information are not authoritative, even though there isn't an actual logical or scientific reason for making that judgment. It's just the mainstream or the establishment protecting itself, trying to keep people within the fold, in a sense, to discourage people from expanding their horizons or looking into any challenging or competing information or ideas. Cults don't like competition. They tend to demonize other worldviews or perspectives, and they often will attempt to scare people, to make people think that if you're exploring other ideas, you're doing something that's dangerous or harmful. We can look at the example of vaccinations. The conventional or mainstream medical model very widely embraces them and looks at them as very effective and relatively safe, whereas other forms of healthcare, other health paradigms will often look at vaccines as unavoidably dangerous, as not really effective, and as presenting a significant hazard. So what conventional medicine does is it discourages people from looking at much of the literature and information that actually are available regarding this topic. It just cherry picks a few allowed sources of information or data. It pushes particular studies or research as evidence of its viewpoint, and it doesn't see or acknowledge the limitations in the types of research it's presenting, and it ignores a lot of other research that actually exists, plus all the clinical experience that healthcare professionals are gaining and what people are actually understanding in the real world about how vaccines are impacting patients or people who are exposed to them. So it's often said that if you're questioning vaccines, if you're a skeptic or opponent of them, that you're putting the public at great risk of much more death and disease. Yet that's based upon the assumption that the conventional or establishment viewpoint is truly scientifically accurate. So it's kind of a circular logic there, that rather than engaging in an open debate or discussion of the topic and forming conclusions at the end, they're starting out with a conclusion and then making a claim based upon that conclusion. If their conclusion is inaccurate and the critics or skeptics of their paradigm are more accurate or have a more clear understanding of things, then in a sense the reverse could be true. It could be those pushing conventional medicine, mainstream medicine, and the vaccine paradigm who are actually putting the public at great risk of much greater illness and death. So you have to go through the scientific discussion to look through all of the evidence, all of the information that's available, and that includes both conventional or mainstream journals and other journals, and includes what all the different healthcare practitioners from both mainstream and alternative or non-mainstream forms of healing are encountering. So you have to look at all clinical data and experience, not just controlled research studies. Research is often designed in a way that's seriously flawed, that doesn't really properly assess a particular phenomena. It doesn't control for the relevant variables in a way where it could actually produce a well-informed conclusion. If you do research that only looks at short-term outcomes or results, then you're missing a potential for there to be long-term outcomes and results that are the opposite of the short-term ones. If you do certain types of research where you're comparing one form of treatment to another and not having a true control group where there's no treatment applied, then you may get some invalid results. These are just a couple examples of the problems that occur with research. You may also have studies where you compare your intervention to a supposed placebo, where the placebo is not actually a placebo. It's something that's not truly inert. It's something that actually could have an effect on the outcome of the study. So in terms of conventional medicine, of the mainstream institutions of the medical model that's dominated our society for a long time, you can see there's a lot of ways in which it tries to impose itself on society. So if physicians are not conforming to the standard of care that's been established or coordinated by those institutions, those physicians risk ridicule, they risk losing their livelihood perhaps. So there's this control system in place that seeks to keep people from operating outside of those parameters. And then that becomes sort of this self-fulfilling system, in the sense that physicians are all practicing in a similar way and they're getting similar results, and they're not becoming aware that you could apply different forms of treatment and perhaps get better results, since they're not allowed to apply those other treatments within the institutions or systems that they are immersed. in order for people to really learn more and expand their consciousness in any field, it's important to have freedom of choice, to have the opportunity to explore beyond the current norms, beyond the overall or general consensus that most people are following. If we look at the medical system, we could see that it's actually quite ineffective at what it claims to be doing. It's supposed to be there to help treat illness and disease and help people recover their health, but much of the time it ends up just treating some symptoms and perpetuating chronic illness, and also failing to effectively treat both acute and long-term forms of illness. And it acknowledges quite openly that it doesn't have cures for many types of illnesses or diseases. So there are lots of serious health conditions people are experiencing, and they're actually going to physicians and institutions who very clearly state that they don't have a cure. Whereas if there are alternative paradigms out there and other types of healthcare providers and practitioners operating from other paradigms who do offer methods of healing that seem to cure, they're the ones who get attacked and ostracized and criticized. And it's as though there's an effort to scare people away from going to them, because if people do go to those alternative healing providers and do experience a cure, then that would provide evidence of their efficacy, and it would provide evidence to contradict the claims of the conventional medical institutions. So the more people start to go to those alternatives and experience beneficial results, the more that becomes a threat or challenge to the conventional medical organizations and to their cult-type mindset, their effort to maintain control, to scare people away from seeing things in alternative ways and trying alternative approaches. If we wish to live in a free society, and we do talk in our society a lot about freedom and liberty and being able to make your own choices, to take responsibility for your own life and the outcomes of your decisions, then we would logically want to apply that idea of freedom to the field of healthcare, to let people inform themselves and make their own choices. However, there are different aspects of our society that are set up in a way to discourage that, to confine people's medical choices. Part of that has to do with the insurance paradigm or systems that most people in our society have to deal with. So in order to pay for medical treatment, most people have to go through insurance. They often can't afford paying for care on their own, and they've already paid for insurance, so they want their insurance to cover services. But the insurance companies and organizations are constricted to comply with the conventional medical paradigm, so much of the time they won't cover services that people might want to receive that are not accepted by the conventional institutions or the mainstream. So that in itself is a form of enforcement, per se, of the conventional paradigm, using the economic leverage. You also have the medical training institutions, and you have the licensure process. So people have to conform to particular doctrines and dominant ways of thinking and practicing in order to complete the medical education and to receive and maintain a license in a particular healthcare profession. So if people are going outside of those norms, they may not be allowed to practice. This presents a challenge to the evolution or progress in these fields, since it enforces a dominant view or consensus. And if someone actually is more intelligent, more conscious, someone is discovering things that go beyond the ordinary way of thinking, then their potential to bring advancement to the field is actually suppressed, since they're the ones who will be ostracized and shut out in a way, and the flawed approaches of the norm or consensus will be continued. So that's been going on in many aspects of conventional medicine, where dysfunctional and harmful practices continue because the individuals who are able to see beyond them to find better ways of treating health or dealing with disease, of supporting health and dealing with disease, those individuals are not acknowledged. They're not allowed to go forward with their discoveries. For those that are seeking to expand your knowledge and understanding of health, I encourage you to not be afraid to question the conventions or consensus. Don't be afraid of people challenging you or threatening you or trying to defame or demean you. If someone says that your ideas, that your alternative approaches are going to cause harm or threaten public health, don't mind what they're saying. Focus on the actual evidence and experience that you've collected, on what you're discovering with your own intelligence, your own experience, your own critical thinking and discernment. That's what's really important. Other people's opinions only have value if they're accurate opinions. So there could be 1,000 people who disagree with you, who think you're crazy, who think that you're doing harm, but if their level of consciousness or understanding of the subject is not so good and yours is more advanced or more accurate than theirs, then it wouldn't do you much good or value to pay attention to what they're telling you. So this is something that I encourage each of us to explore more, to see how we're addressing or responding to that type of cult mindset that's often permeated the medical system. This situation is becoming more and more obvious as efforts are becoming more and more intense and aggressive to shut out alternative viewpoints, to suppress anyone who's speaking about medical and scientific information that challenges the sort of top-down hierarchical control structures that have been in place. So we want to look at things more scientifically, where there's open discussion and debate and continuing refinement of understanding, rather than a system that operates like a cult or religion where dogma is being enforced, where anyone who is not in conformity to that is viewed as a dangerous heretic. That's not how science advances. So I appreciate each of you who are viewing this, who are seeking to expand consciousness and further or foster health and well-being of yourself and others. You can view various other videos on this subject on my channel on YouTube, and you could also visit my website phinsights.com to find many additional references and resources for holistic health. I'd like to wish everyone a wonderful day. Namaste.